Bacterial vaginosis causes a gray vaginal discharge with a fishy smell. Guys, you don't want to have this. Hello there, welcome back to my channel. I'm Teddy Blessings. If you're new, subscribe and don't forget to hit the notification bell so you get alerted each time I upload a new video. So in today's health talk, we're going to talk about vaginal discharge colors and what they indicate. So if you're interested, stay tuned. Vaginal discharge is normal. It is a fluid secreted by tiny glands in your vagina and cervix and carries away dead cells and bacteria so as to keep your vagina free of infection and clean. Most of the times, vaginal discharge is perfectly normal. The amount varies, and so does the odor and the color. It can range from clear to milky whitish, depending on the time of your menstrual cycle. For example, the discharge may increase if you're ovulating, breastfeeding, or when you're sexually aroused. And then the color also may be different when you're pregnant or when you've let your personal hygiene slide. None of those issues is a cause for an alarm, but if you notice a change in the color, in the smell, and in the consistency of the discharge, more so if you have burning and itching associated with it, then you could be dealing with an infection or another condition. So let us talk about that vaginal discharge colors and what they indicate. Let's start with the red or pink vaginal discharge. This can be normal or abnormal. So if you're nearing time of your periods, you may get a pink or red vaginal discharge, and this is normal. And then when you're turning towards ending your periods, you can also get red discharge. Actually, in most cases it is brown, because the movement of the blood is now slow, so it stagnates in the vagina and it gets oxidized, thus the brown color. So it is normal if you're about to end your periods. And then if you're pregnant, like there is what we call implantation bleeding, when the fertilized egg gets attached to the thick lining of the uterus. There may be some bleeding, and this may come as a vaginal discharge, but red or pink, most cases pink in color. So if you recently had intercourse and you missed your period, you may be pregnant. Then if you've had your periods and like after a week you get a red discharge or a pink discharge, this may be abnormal. This is what we call intermenstrual bleeding or spotting, and here you need to see a doctor and rule out the actual cause of the intermenstrual bleeding. A red vaginal discharge could also be an indicator of a miscarriage. If you recently found out that you're pregnant and then you start seeing a red vaginal discharge, it is better for you to see a doctor, because it may be a sign or an indicator of a miscarriage. Then there are also some women in menopause. You've stopped getting into your periods for a year or more, of course when you've hit the menopause stage, and then all of a sudden you start getting a pink or red discharge. You need to see a doctor immediately, because it could be a sign of endometrial cancer. So you need to see a doctor because it is actually abnormal. The second vaginal discharge color is the yellow greenish color. Guys, this is not normal. It actually indicates that you have an infection, most commonly the STI known as trichomoniasis. This is caused by a protozoan parasite called Trichomonas vaginalis, and it is the most common non-viral STI in the world. Though symptoms may vary, some women may have the parasite but don't know that they are actually infected. Trichomoniasis can cause a frothy yellow-greenish vaginal discharge with a bad smell. And some other symptoms include burning and itching, pain during intercourse, soreness, among others. So the good thing is this infection can be treated. But if you're a married couple, if you're a couple actually, though married or not, you need to treat the other partner, because you can actually spread it to them. Remember, it is sexually transmitted. Then another infection that can cause a yellow discharge is gonorrhea. Most of the women that have gonorrhea are actually asymptomatic. They don't show signs and symptoms, but if the symptoms come with a yellow discharge, you can also get abdominal pain and then itching and burning when urinating. So you have to see a doctor, and then they will be able to treat those infections. The other discharge color is the gray vaginal discharge. This is also not normal. It actually indicates that you have an infection known as bacterial vaginosis. This results from a change in your vaginal pH, which causes an imbalance in the vaginal bacteria. A certain bacteria known as lactobacillus keeps your vagina slightly acidic, so the bad bacteria won't grow. But if the levels of this bacteria go down, then it gives room for the bad bacteria to grow, causing BV, which is bacterial vaginosis. Certain practices or certain things like douching, using bubble baths, using scented soaps, using vaginal deodorants can alter your pH and risk you to getting bacterial vaginosis. So bacterial vaginosis causes a gray vaginal discharge with a fishy smell. Guys, you don't want to have this. The other symptoms may include burning and itching, and you also have to see a doctor for this infection. They'll prescribe for you the appropriate antibiotics and the other treatments, all that is needed, and then you get well. This is also treatable. The other discharge is the white, thick, clumpy vaginal discharge. This is an indicator of a yeast infection commonly known as vaginal candidiasis. You know, a healthy vagina has bacteria and some yeast cells. So if there is an imbalance between the bacteria and the yeast cells, maybe due to concomitant use of antibiotics, then the yeast cells can multiply and cause this white, thick, lumpy vaginal discharge. Some say it looks like cottage cheese, and it can also be creamy. It is also associated with some other symptoms like itching, burning, soreness, swelling, and a rash. So if you get this, sometimes it can clear by itself, but sometimes you need to see a doctor, most especially if you're pregnant. You have to see a doctor so they can put you on treatment. It is commonly treated with antifungals and it can clear. So having talked about all those kinds of discharges, how can you help yourself prevent having an abnormal vaginal discharge? Make sure that you wash daily. Daily. You can use warm water preferably, and wash on the outside, on the vulva. Avoid going deep inside, as this may cause infection and also abnormal vaginal discharge. Then avoid using feminine products like douches, avoid bubble baths, scented soaps, feminine sprays, vaginal deodorants. Avoid using all those things because they will alter the pH of your vagina and then cause infections like BV and the associated abnormal discharge. Then also, after using the bathroom, wipe yourself from the front to the back, because when you do it from the back to the front, you transfer all the bacteria from the anus to your vagina, and this will cause you many infections. Then the last and not least is put on cotton underpants, because the other synthetic underpants are associated with sweating, and then they cannot absorb enough sweat. Then this will all cause infections which will come with abnormal vaginal discharge. So guys, that's all about vaginal discharge. And if you see the green vaginal discharge, if you're pregnant and you're getting abnormal discharge, if you're in menopause and you get a red vaginal discharge, you need to see a doctor immediately, because some of these, although some infections like yeast infection can clear, others you really need to see a doctor. So I hope you found this informative and helpful. If you really found it informative and helpful, give it a thumbs up, and don't forget to share and like and subscribe. Thank you for watching. See you in my next video. Bye.